Hey folks, how's everyone doing out there in YouTube land? Dr. Dan here, Ozark MMJ Cards. Nice to meet you guys. Always a pleasure. So great topic today, cannabis and pregnancy. This one is real popular, real hot button topic because there's a lot of unknowns here and plenty of controversy to go around. I'll just jump in right off the bat. The CDC recommends against using cannabis products, including CBD, okay, during pregnancy. Now, let me just jump in and say just that, we haven't really landed on getting good peer-reviewed data regarding cannabis use and pregnancy. So I did want to jump in and just say that the guidelines, at least by which the CDC is following, is really just based on theoretical caution, okay? Because we don't like to really take chances with an unborn baby, and having a mother taking chances on things that we haven't researched. And that's the reason why they recommend, excuse me for the bounce. That's the reason why the CDC recommends against using cannabis products while pregnant. It's not because they have hard data to say that cannabinoid exposure will put the fetus at some developmental risk. It's that we don't have any data, and people want to remain cautionarily safe and not risk it. So the reason why it's recommended against is because we have insufficient data to co-sign on its safety during pregnancy. Now, with that being said, the issue of pregnancy-related nausea still exists. Intractable nausea, meaning not able to stop the nausea despite normal treatments. Now, normally, when someone presents with usually first trimester nausea, it can carry out through the pregnancy. People will tell you sometimes that first trimester nausea will carry out sometimes all the way into the third trimester, albeit not quite as severe. If someone has hyperemesis gravidum, then their nausea is going to carry on. Nausea and vomiting will carry on longer into the pregnancy. Now, just some important points. Some people cannot tolerate the normal right off the shelf prescriptive treatments like Zofran, ondansetron, which is a medication that we will prescribe for people who have nausea and vomiting. Now, if someone either cannot tolerate Zofran, or they don't want to take a prescriptive medication, or it just doesn't work anymore, not many other options, okay? Not many other options. So then there's the idea of cannabis. A lot of people, pregnant ladies, will turn to cannabis despite the CDC's recommendation that they not do so. And this has been an idea borne out into practice. This has been going on for who knows how long, decades, maybe centuries. People have been getting nauseated while pregnant for as long as we've been humans and getting pregnant. And at some point when people landed on the idea of cannabis and found out that it could really curtail the nausea, they've been using it since then. Okay, so this idea of pregnant ladies using cannabis, it's not new. Okay, it's totally not new. The only caveat really just comes in as a physician, we are not to recommend it to pregnant ladies just following course, in that it's just recommended against by the CDC. So just to be responsible, we have to make that recommendation by the CDC, make that available to patients so that they can make their own informed decision. Now, in the peer-reviewed literature, we just don't have any evidence to say that for certain using cannabis products can result in neurodevelopmental abnormalities with the fetus. Okay, that is the thinking, okay, the theoretical thinking behind recommending against cannabinoids to pregnant ladies. The thinking is that because the endocannabinoid system is so ubiquitous and widespread that taking an external dose of cannabinoid can interfere with the developmental process that's governed by the endocannabinoid system, okay, which sits very centrally in our central nervous system and is part of the developing central nervous system, all right, and guides the timing of certain developmental events that occur, in the newborn fetus. So, because the endocannabinoid system is so intimately involved with it, then taking an external dose, in theory, could interfere with the delicate balance and symphony and interplay of molecules that are working together during development. All right. So there's that. That's the reasoning behind not wanting or recommending against people indulging in cannabis products. I don't want to say indulging. That's a very loaded word. Medicating with cannabis products while pregnant, because it could disrupt the endocannabinoid system. Now, that's a theoretical concern, because this is not the kind of thing that I think people could get the clearance to readily test, but that's the thinking behind it. Okay, so there's one. Secondly is, and I think more importantly, is the issue of smoking. All right, the issue of smoking cannabis products, say, versus eating them. Smoking anything while pregnant, probably a bad idea. All right, potential for lower birth weight child and potential for pulmonary damage, okay, to the developing fetus. All right, being able to produce enough surfactant, being able to get a large enough lung and have a large enough oxygen exchange area so that an infant can have independent respiratory drive and be able to breathe and have oxygen and carbon dioxide exchange at the alveolar level. Alveolus is the singular unit of the lung, little small air sac, at which there's oxygen air exchange from the air into the bloodstream and carbon dioxide leaving the blood going into the air. Okay, so smoking of anything, be it inhaling a big plume of barbecue smoke, cigarette smoke, cannabis smoke, they're not equivalent smokes, but inhaling smoke could put the fetus at risk. So that is a valid concern, 100%. So I recommend against that in pregnant females, taking while they're pregnant. So that's really, in my opinion, the main concern. Whether or not the endocannabinoid, whether or not taking in external cannabis therapy, whether or not that part is explicitly dangerous to the developing fetus, well, we're still waiting on the research to give us a hard definite on that. In my opinion, that's still sort of up in the air. And I think for the most part, probably, not definitely, probably is a dose related thing, not just a discrete, you use a little bit of cannabis products and then you're going to be putting your fetus at harm. I don't think it occurs that way. I think it'll be a dose related thing once we do come upon the scientific data that possibly using too high of a dose of cannabis might come to some consequence on the developing fetus, okay, as far as neurologic development goes, all right? And so, another point that I think is valid for us to dig into is the idea of breastfeeding, okay? Is a breastfeeding mother, is she going to be exposing her breastfeeding child now that's out of the womb? Are they going to be exposed to cannabinoids? And the answer to that is maybe, probably, I think. And here's the reason why. Cannabinoids are fat-soluble molecules, so they're stored in adipose tissue, all right? Dense breast tissue, breastfeeding tissue, it'll stick there. The cannabinoids will be housed in that adipose tissue, all right? So theoretically, it can pass, which is right by where the milk ducts come to sort of coalesce and feed together. So if the THC and CBD and all of the other accessory cannabinoids are being housed there in that fatty breast tissue, then there's pretty much a high likelihood that those metabolites, albeit probably inactive metabolites, good chance that those metabolites could pass through and get into the baby's system. Now, the big question is, does this mean anything? Will this come to any consequence? We haven't seen anything to that effect that we can ascribe causal consequence, meaning mother has taken cannabis, passes through the breast milk into the fetus, and then the fetus comes onto some sort of health consequence as a result. We have not seen that for sure borne out of the literature. So for the most part, everything regarding cannabis use and the pregnant or breastfeeding female, for the most part, what I'm getting at, a lot of this stuff is just speculative, people. But based on that speculation, the governing bodies, for the most part, have come to a loose, unanimous decision, very, very loose because it's cannabis, just sort of coming with a blanket recommendation that it's something that females should not engage in while pregnant or breastfeeding. That's the CDC's recommendation, but I think it's important to understand the caveats of how they came to that notion. Okay, so officially, folks, so that's where it stands. We are to direct patients to the CDC's recommendation to not take cannabis products while pregnant, because they can't say for certain that it's all the way absolutely 100% safe, but therein comes the argument, what is 100% absolutely safe? You can take you can have, I believe, up to, I think, 100 milligrams of caffeine per day while pregnant. Once you exceed that, you could be putting the fetus at risk for, just a number of things. But you can take caffeine, but up to a certain upper level safe point. And beyond that, it becomes unsafe. My theory, my hypothesis is that cannabis and cannabinoid products would follow a similar logic where you can take in safely a certain amount, and once you exceed that amount, you'd be putting your fetus possibly at risk. So that's where stuff stands right now, folks. I just wanted to keep you abreast and updated, as far as that goes. Some of the concern really here is neurologic development and birth weight. Okay, but these are just theories. Okay, this is speculative stuff that we're working off of, and not hard data that's been put through peer review literature for scrutiny and dissemination. So that's the important thing that I wanted us to land on here. We haven't done experiments and gathered big populations of metadata that we can look at big numbers and make more definitive conclusions. We haven't had those large scale studies where we can make definitive conclusions. In other words, we're just playing it safe so that we don't cause irreparable harm and then look retrospectively and say, oh, oops, we shouldn't have done that because it's a developing fetus. And that's not something that we tend to take a lot of chances with. So that's where that stands. Anyway, I just wanted to give you guys the lowdown on how that goes, pregnancy and cannabis, because very important subject. A woman being able to get good nutrition and good hydration is really, really important. Okay, if someone has intractable vomiting, then they're not able to remain hydrated. They're not able to get nutrition to the fetus. Okay, all of these things are important to maintaining a good intrauterine environment for a developing baby, so that you have enough placental fluid and just enough fluid support and nutritional support for the baby. So ultimately, cannabis or not, being able to control being able to get good oral hydration and nutrition is paramount. So that's where the decision really lies. Risk of exposure to cannabinoids, risk of not getting adequate hydration and nutrition to the fetus. That's where ultimately the weighing of risk lies. Okay, exposure to cannabis is going to involve a certain level of risk. All right, not it's a numerical risk we haven't landed on yet. Not getting adequate hydration and nutrition, oral nutrition, that has a certain level of risk, all right, which we've dug into, and we can semi-quantify that. We can at least qualitate that, all right? A bad thing. We don't want that. So ultimately, we want to get control over nausea and vomiting and get good nutrition to the baby, really no matter what. I don't want to say no matter what, but it's super important. So if the risk is tolerable and the benefit is high, then that's a treatment that we can undertake. So that's what we're aiming to find, is the risk with cannabinoid exposure tolerable enough such that we can reap all of that benefit of getting adequate, good, generous hydration and nutrition into the mother so that we can pass it along to the fetus. Cannabis and pregnancy, hot button topic. Nausea, not a small thing in pregnancy, especially when it becomes protracted and intractable. All right. Hey, folks, thanks for joining me. Just wanted to give you a little bit of tidbit info on pregnancy and cannabis. Thank you so much for being a great crowd. Again, guys, if you have any questions, hit me up. Don't forget to like and subscribe to our channel, Ozark MMJ Cards. Don't forget to hit up our website, www.ozarkmmjcards.com. If you're seeking your cannabis certification in Arkansas, Missouri, or Oklahoma, we provide fast, dependable, reliable, friendly, cost-effective service. I don't want to make this too much of a selling point, but for those seeking out their cards and seeking good cannabinoid medicine-related advice, we're the ones to seek out. Okay? Love you guys. Talk to you soon.